From the pressure of emergency rooms to the heartbreak of patient loss, nurses operate in an environment of constant stress. But the greatest threat to their well-being is not just the work itself. It is the compassion fatigue that sets in when they are constantly overworked and undersupported. Health experts are now warning that when a nurse is mentally exhausted, the entire healthcare system is at risk. Mental health is not just a personal issue, it is a safety issue that directly impacts the quality of care every patient receives.
We know that nurses are at the forefront of care for everyone. And when nurses fall ill, as you said, who takes care of them? So it is important that they develop resilience with them, make sure that they take care of their mental health. That would involve regular exercise, eating well, and taking time to sleep. Make sure you get to 6 to 8 hours of sleep every day. And also when there is an adverse event, remove yourself from that adverse event, take a break, reflect before getting yourself back into it.
Mental health for nurses is very, very essential. So we will advise that the government and private institutions should ensure that they take the welfare of nurses to be very essential. Let them provide basic amenities for them. Let them recognize nurses as a very center point in healthcare delivery.
The diagnosis from the front lines is clear. The current working conditions in many facilities are sustainable only at the expense of the nurses' health. Administrators are being urged to move beyond empty appreciation and toward practical action. Better staffing ratios, mandatory rest periods, and the integration of on-site counseling services within hospitals.
We are giving care to the general populace, so we also strike a balance when there is weakness, when there is when we are weary, when we are very tired, when there is fatigue. We try to take some rest. But I would just say an appeal or a prayer to our managers, to our directors of hospital services, to the government to also give time to special cares for these healthcare professionals.
Pay attention to exercise, because regular exercise make your nerves to relax and also be able to rest as well. Most of the time when you do exercise, you know that it's always an inducer of sleep. When you exercise, you sleep, and when you sleep, invariably you will rejuvenate your mental health, and you have that balance to be able to face any challenges that comes your way.
One of the biggest hurdles is the culture of silence. Leaders in the nursing profession are speaking out against the stigma that keeps many nurses from admitting they are struggling. They are pushing for a workplace environment where seeking psychological help is viewed not as a sign of weakness, but as a professional necessity.
We have a large burden of work because of the gross inadequacy of nursing workforce, which has actually given the nurses available a higher responsibility to do. When nurses are supposed to cater for, maybe 4 or 5 nurses are supposed to cater for a particular group of patients, and one nurse is doing that, that can actually affect or bring about burnout on that particular nurse, and there's no doubt the mental health be affected. But what we can do is to prioritize our care for our patients, to seek for assistance where necessary, and to take care of ourselves.
As Nigeria's healthcare demands grow, the government and private sector must recognize that protecting the mental health of nurses is a national priority. Respondents say we cannot continue to demand exceptional care for our patients while neglecting the well-being of those who provide it, stressing that to sustain a strong health system, we must build one that cares for the caregiver just as much as the patient. Olaide Oloye-Soluade, OGTV News.